Hey folks, Dr. Gerstmar from Aspire Natural Health here. I wanted to share with you a very interesting old school treatment which has to do with immune boosting and acid. Not the trippy LSD acid, but actually stomach acid, betaine HCl or just HCl hydrochloric acid. And so, as you might know, there are a lot of nasty colds and flus going on right now. We've had reports from our patients of stomach flus with vomiting and diarrhea, of colds which are mostly up here, so lots of snot, lots of mucus, lots of just feeling kind of cruddy with coughs and things, and then more of your classic flus with fevers and aches and pains and lots of fatigue and all of that. So a couple days ago, one of my lovely darling children brought home what we think is a flu. Again, not to get too much into this, but a flu is something caused by the flu virus, right? That's what there is the flu vaccine for. And what we found is that there are many what are called flu-like illnesses. So they look like a flu. Again, a flu is something with fever, with kind of overall body aches. There may be a little bit of kind of mucus in and around the nose, but not primarily. So a couple days ago, one of my lovely children brought home a flu into our house, which has just destroyed my wife. Been really non-functional for a couple of days. My son had it as well, and just this morning, my daughter came down with a fever, so she has it. So as you can imagine, trying everything not to get the flu. So everything from sensible eating, getting enough sleep, managing stress, all of those pieces, using some of supplementation of herbal formulas. But one other piece I decided to pull out, because this is such a nasty one, is this acid treatment. So what is it, you say? So just so you can see, so needle, if anybody's squeamish, so got a needle there into a hand vein, and we've got a little syringe which contains some very diluted hydrochloric acid. So yes, the same thing that is made in your stomach can be taken and very cautiously put into your veins. Why? Well, this was discovered back in the 1920s, and if you recall, in the 1920s there were no antibiotics, or there were just the very beginning inklings of some antibiotics. So people were desperate to try and find something that would have an effect on infections. And truthfully, I don't know how they stumbled upon this treatment. But what happened was it was used very effectively, and then when antibiotics came on the scene, like many other treatments, it was swept aside because the antibiotics were cheaper and easier, and in many cases more effective. But what we're finding now is that there are a lot of situations where antibiotics are inappropriate, or there's a lot of situations where we're looking at antibiotic resistance and we're finding a lot of those antibiotics are no longer working. So we're looking for treatments that can still help people. And in a lot of cases, it's going back to the older literature, the pre-antibiotic period, and reassessing some of those treatments and seeing if they have value. So, what's the deal with acid, right? Now, where antibiotics work by killing bacteria, and it's really important, I know you guys probably know this, but let me say it anyways. Viruses, the things that cause colds and flus, are viruses. Antibiotics have absolutely zero effect on viruses. They will not help at all, and you run the risk of getting the side effects of viruses, of the antibiotic. So why are they often prescribed? There's two reasons. The first is sometimes if a viral infection weakens your system, you can pick up a bacterial infection. And so it's given to guard against it if your people are weak or they're sick. Often in the elderly, for example, antibiotics are given to try and prevent any secondary bacterial infection. But when it comes to the actual virus, the antibiotic does nothing. The second reason antibiotics are so commonly given is because people pester their doctors for antibiotics. Your kid is sick, or you're sick, or someone you love is sick, and you want something to do, and in the conventional world, there's not a lot else. So there are some antivirals, a topic for another time. In the short version, they're expensive and they don't work all that well. They have their place, but they're not great for colds and flus. So please, please don't take antibiotics for a cold or a flu or another viral infection. It won't help the viral infection, and it contributes to causing antibiotic resistance. So Things like antibiotics and antivirals focus on weakening or destroying or killing the infection. Things like this acid here and many of our herbs do the opposite in a sense. They don't necessarily focus on the infection itself, they focus on improving the immune system. And so what we found with this HCl treatment is that it doesn't affect the infection, but it does boost the immune system. We don't know exactly how. There's not a lot of research that did or is going into researching, cheap formula like this, but we know it boosts the immune system. We know it's also a short-term effect. It lasts between 3 and 4 days, which for me is great because in the next 3 or 4 days, I've been exposed to the same virus that my family has now. And in the next 3 or 4 days, I'm either going to get sick or I'm not going to get sick. And so the point of doing this treatment is to boost my immune system to see if it can destroy the infection before it ever becomes manifest, before I get symptoms and ever have to deal with it. So this HCl treatment is useful anytime you want to boost the immune system. So this really is something, it needs to be done properly. You are doing an injection, so you need to use sterile technique. It doesn't inject, with dirty equipment and getting bacteria into your bloodstream, not a good thing. So please, this isn't something you do at home. Any doctor can do this treatment. It can be used, again, both for colds and flus like this, people with immune suppression, or if we're dealing with chronic infections like Epstein-Barr virus or any of the others, it can play a part in helping people get better. It's a really cool treatment. It takes about 10 minutes to do, so we're coming up on 7 minutes here, and I'm almost done with this treatment, doing the injection kind of slowly but steadily as I talk here. But it does need to be done by a doctor. Now, any doctor can do this treatment. It's not, the HCl is not commonly available, but it can be gotten from compounding pharmacies. So any doctor with interest and a license can get the HCl and can administer it for you. All right, folks, I thought it was interesting. It's a cool treatment. It's another tool to have in the toolbox to help with infections, both acute ones like colds and flus, and chronic infections as well. If it's something that interests you, talk to your doc about it or give us a call. If you're local and in the area, we can set something up. All right, folks, at Aspire Natural Health, we are experts at treating gut problems, autoimmune diseases, and other hard to treat cases. Taking a little time off here to take care of a cold and a flu. Hopefully in the next couple of days, I will not be sick. All right, if we can help, give us a call, get in touch with us. Till we talk again, take care.